Good morning and welcome to Daybreak Africa, coming to you from our studio right here in Ondo City, the sunshine state of the nation. I am Angela Daku.
And yes, it's a beautiful morning. Welcome once again to Daybreak Africa from our studio in Ondo State, which happens to be the sunshine state of the nation. And my name still remains Ikhonede Joshua Deji.
At the moment, the rainy state. We've been saying this thing for how long now?
I beg the rain. I beg the rain. The rain refused to.
Go on, Miss Rainmaker.
The rain refused to. I beg the rain.
For Joshua's sake.
This month, at least calm down. Calm down.
Well, I don't want it to calm down. She continue.
Continue. Why? Why? These are the village people I'm talking about. Like these are them.
we need it. Yes.
No, but honestly, it's unfair. They are you just go to.
Why?
You just need the sun.
Are you an enemy of water?
I'm not an enemy of but
are you an enemy of good weather?
This time around it's looking more like flood. And I'm just skeptical because I know people who actually have products out there that will want to, they don't really have the system to yet guide against floods and all that. So God will help. God has given the intelligence for help. And some have not. The only thing you can do is to pity people in the actual sense and just let it be. But then the weather,
the weather is quite conducive.
It's quite conducive, yeah.
Of course, and I'm very sure it's quite conducive for pregnant women at this point.
Yeah, the weather would have been there. The entry road into pregnancy in the first instance, and it's still going to be a bit comfortable at this particular time. But then pregnant, it depends. Maybe the ones that are not really very touchy when it comes to their pregnancy, or they are not really very, because pregnancy differs when it comes to pregnancy. It differs from people. Everybody has their different natures during pregnancy. There are some that I remember when my wife was pregnant and all that. I know this is not the lady I went through a phase in my life that I'm like that. Maybe that's the reason why I've delayed the second one from coming. Like, I don't want to see that personality.
You have to see it in another form this time.
Yeah, maybe in another form, but no.
What?
That I don't know. That is the reason. That exactly is the reason.
You can't avoid it. Yes, it has to be before life comes.
Maybe because she's a first-time mother, though. So maybe that's why it was like that.
Talking about first-time mothers, you'll be talking about the difficulties they face.
Yeah, they face during that phase and all that.
Giving birth. There are so many stories.
A lot
of stories. I think that in Nigeria we've seen many situations where first-time mothers face major challenges. I don't know if it's because they've not given birth before, or because the body probably is trying to, it's a new thing.
It's a new thing to them. I think that the newness of it to them, first-time pregnancies, you never know what was their story before they became pregnant. So definitely it's second time pregnancy, okay, it should be more expected, but that's the chances of it being more expected, more experienced and all. But the first time, a lot of things comes to play with the first time pregnancies and all that. I think we'll look at that today, and logically on Daybreak Africa.
We'll definitely be looking into maternal health and probably lifestyle and the way to go during the course of conception, more with the guest who is already in the house, a medical professional at that, who will be bringing the light to us on this particular topic. However, I'll be going for the report of the day, so do not go anywhere. We'll be right back. Stay tuned.
Well, welcome back to the show. If just joined us, it's still Daybreak Africa, and it's time to go straight into our discussions for today. I hope you're enjoying the reports we gave you in the initials. But then, let's go straight to our reports. Today, we're looking at something quite vital at this particular time, especially when we look at maternal health to women out there, especially first-time mothers. And today, we're looking at cultivating healthy lifestyles for successful deliveries, for an avoidance of some kind of complications that comes with childbirth and all that. Looking at the fact that statistics shows that multiple times first-time mothers experience gross levels of tears and many times complications here, there and all that. Not just them, though. We know that even some who are very constant with that as well as also experience health things. But then people have argued over time that if you cultivate an healthy lifestyle during your pregnancy phase, you can in the actual sense avoid a whole lot of these old issues at those particular times. But then many people actually learn this thing, but it's good sometimes you bring exciting teachers to this particular phenomenon. And I was going around Ondo, and I discovered a very exciting teacher actually, who happens to be a medical practitioner, who she's a person of many sides in the actual sense, a medical practitioner. She is into obstetrics, I think obstetrics here, and she is Dr. Olajide Oluwatomi. Welcome to the show, man.
Thank you so much. A pleasure to be here.
And it's a pleasure to have you actually in the actual. And you know, like I said, this is not the I'm just going to warn you in advance. This is not the conventional doctors. It's going to be a very exciting discussion. It's a very exciting discussion actually. But let's start from here. First-time mothers, maternal health in a country like Nigeria specifically. How will you comment on the state health-wise of most first-time mothers and how they tend to, you know, go through the pregnancy journey all through the time of childbirth and sometimes experience a lot of at least at the first time? How do you see, what's your comment on those kind of people at this particular time?
Okay, first of all, let me say it's a pleasure to be on the show once again. And I think I'm going to answer the question regional based, if you permit me. Like, I growing up in the north and getting some of my experience in the north before I came down here to the west, I think it has to do with mindset at first and how people value healthcare. Now for the north, an average northerner doesn't really believe go to the hospital. Why? Because they have their own setting when it comes to health and treatment. They have their own local system where they go for their gargagia, which means local traditional herbs and stuff. They still believe very much in it. In fact, most of public health invest on educating them that the government is not out there to kill you by giving vaccinations. Yes, as common as vaccination, some of them don't take them. And then when you come down west, due to education being much valued, most people know pregnancy, as much as it's not an illness, could land you into a lot of trouble if you don't take the right step. Now, in the East, they too are also a little bit educated, but they will do what they want to do based on if it will cost their pockets. So that's why I thank God for the Ondo State government, who actually has a package for pregnant women, something they call EBIO, in which they come and they get some kind of discounts that will help with the whole pregnancy state. So most first-timers are actually excited because it's the first time they're getting pregnant. They turn up. Then they now say, oh, now that I've been pregnant, the second pregnancy, I've done it before, so I'm good to go. And that's why we now get issues. Now the question you ask, are first-timers in some kind of danger if they don't turn up? The answer is yes. And as the program goes on, I'm sure you get more educated. That's one of the biggest dangers, not only the tears people are worrying about, is something we call preeclampsia, which is hypertension in pregnancy gone very wrong. And sadly, pramigravidas, who are first-time pregnant women, is a risk factor.
Oh, that's scary. But then you talked about it across regions. You talked about the north, the west, and the east in the actual sense, and how they react towards issues that has to do with pregnancy health and all those kind of things, maternal health and all those kind of things. Now, and you talked about your experiences over the whole two places. But then let's streamline it a bit to this point. And you talked about a bit of some complications that we should even be more scared of than even the consistent tears we talk about. But then let's start from here. What do you think, as someone who is pregnant, the first thing that one should be thinking of, especially for first timers, what should be the first thing that should come to your mind whenever you just get to the point of pregnancy? Because many don't really, because we know that many times the entry to first time pregnancy, especially in the current times, is not sometimes pleasant circumstances. Some could be after marriage, some could be out of wedlock, some could be maybe rape, and okay, just keep the child, religious factors and all that. Some the circumstances could be the issue of anything could be religion and all those. But at least for a woman who gets there for the first time, what should be the first step towards just ensuring, okay, at the end of the day, I should be able to come out with a successful delivery that won't have any complications at the end of the day?
That's a very valid question, as silly as it sounds, what should a woman think? I always tell people, as you said, you've touched the areas of a clacking. Clacking is collecting of information. We do. We always ask this question, and it sounds so silly to the mothers. How did you get pregnant? Was it natural? Meaning, did you do an IVF, which is not natural to get it? Did you plan for it? That brings in the picture of what? Rape and other things. So you can know how you're going to talk to this mother. And the funniest of all questions that most of them laugh about, but you now see in a reaction in another person. Do you want it? So we ask people, is this spontaneous? Was it planned? Is it desired? Because this has covered everything. You're surprised, right? It covers everything because we think about it when we get our first timers. We want to be in the journey with you. If it's a rape case, we'll know that this is a child that might suffer in the hands of its mother. So we're already giving an alert to the pediatric department. This person is going to come. Please keep an eye on her. Make sure this child gets vaccinated. Put a call to her. It's not careless practicing of medicine. And then if they wanted the pregnancy, good for us. How can we now think normally? Still involving the lady who got raped. I tell people, it's a sad thing to say, but your baby is a parasite. He's going to feed on you. So if you're not eating well,
definitely you're going to, he's going to.
So every pregnant woman should think of what they're going to eat, how they're going to appear, what are the complications of the pregnancy. For some people, I tell you the story of pregnancy for she might come up with, I was pregnant, I was so beautiful, my hair was growing, I was glowing, and another woman was like, pimple burst out of my face. I didn't know how to work again. I had this fibroid I never knew that was going to grow and make my life miserable. I was shitting and my anus came out. You hear all sorts of story. Why she was telling what? I was glowing. So it's different for different people. It has to do with your genetics. As a black woman, you already know that you're prone to hypertensive. As a white woman, with all their genetic stories, you might pass something down to your child. So I tell people, it's not about just I am pregnant. It's what did you do before you got pregnant?
First things first. What did you do before you got pregnant?
Because, funny enough, we seated here, there are some people who don't know their genotype. And they don't know how dangerous that is. And then they now come and say, I gave birth to my child was yellow, all I know the child was shitting yellow. How you know go shit yellow shits? Because one of the complications of an AA, marrying an AA, is that you get DSTV, meaning you can marry anybody. But the moment an AS marries an AS, you might have an SS, which is a sickle cell everybody is scared of. So if you are not planned for that before you got pregnant, are you not in for an interesting story? In short, a super story.
Extreme story. Series.
So you can see how you've not imagined enough, and then you're asking questions after the story has already begun. So it's not just about what are you expecting, it's what did you do before you got pregnant. Now there are some people that have complications that they don't even know exist. They come with the story of, doctor, I was pregnant, and then when I got to second trimester, that's after 12 weeks, and the stomach started becoming big, all of a sudden the baby comes out. It's happened again. And you know, we call a baby a miscarriage. We don't call them another name that everybody don't like hearing. They keep on having miscarriage. And then sadly, some of them are going to church to pray about it. They tell them to come to the doctors. And it's as simple as what? Just sewing the cervix. But they go from one church to another. My village auntie is praying hard. Oh, this person doesn't want me to keep her. It was just something called cervical incompetency, in which the cervix, instead of staying closed, as soon as the baby becomes bigger,
it opens up.
And just to sew it and tie it.
So that this is will give the baby. Yeah.
And once the baby gets to term, which is 37 weeks, not even the 40 weeks that everybody talks about, you can bring that baby out. And by God's grace, most of them do okay. So there are lots of things, can you see? And she has to tell us this has been happening before we plan her pregnancy, because we tell her when to come so we can sew it. So I won't lose that child. So I tell you, this story of pregnancy doesn't start off, I am now pregnant, I'm here. No, sometimes it starts with, I want to get pregnant. What can I do? There are some people that have the history of neural tube defects, where a child has a hole in the spine. Yes. And the solution is as simple as what? Take more folic acid. Some people now say, it's one Satan in their village that always puts hole in their child. They will not go. That's why if you're educated enough, you know there's something we call preconceptional care.
Preconceptional care.
What you do before the pregnancy. And most of us in the country miss that aspect. They always come pregnant. And most of us will now have to dance with the story that we see. And most of them, believe me, are sad ones. Simple things that could be avoided. So my dear, as I said, yes, there's a lot of questions to ask now I'm pregnant. But the most important question that most of us miss is, what should I do before I get pregnant? A 20-year-old, okay, let me use the correct word, a 25-year-old will not be thinking of certain things a 45-year-old woman will be thinking when she's having a child for the first time. And now that we are in the educated world, most people are not even giving birth in their 20s any longer. People wait till 30 and early 40s.
And early 40s,
yes.
To be better.
So we have to keep an eye for that as obstetricians and gynecologists, because the world is now also changing in Nigeria. You see people who watch WWE, they prepare as saying that the 30s are the new what? 20s. They promoted that because most of them gave birth in their late 30s because they were wrestlers. They couldn't afford to get pregnant. That's the end of their career. So they waited well into their 30s and 40s before they got pregnant. So the world is changing. The advent of IVF has solved the problem of women being insulted. Now all cargo should not be born for you. A 60-year-old woman has carried her child.
Neat.
So the world is changing.
So the world is changing.
I hope that answered what you need to do.
Yeah, in fact, it hits the nail on the head.
Well, we talked about the different stages of preparations, which is the pre-conceptional stage, and then we have the prenatal,
Antenatal.
and then
Good.
that's the
And
then
postnatal.
postnatal. So, which of these stages is the most important?
That's going to be a hard one to answer, but the truth is that for every stage there is a different story. I'll give you why every stage is very important. I told you at first, a woman says she has some diseases that are known in her family. You now tell her to come for a preconceptional care before she gets pregnant. So you could identify, even do something we call chromosomal testing for her and her partner to see whether if they meeting can cause them to have such a child. For example, something called cystic fibrosis, as simple as it is, that it mostly affects the respiratory system, it can also affect cilias. And your cilias is very important for the transfer of sperm into the uterus, into the fallopian tube, where fertilization will take back and then bring it back. So you can imagine if the cilias of the tube of the fallopian tubes are not working, that's infertility right there looking at you. And it will be that our family just have cough and catarrh. If you don't investigate it, you will not know that it's what? Cystic fibrosis. And that's why we will be saying I've been trying and trying. It's our villagers that don't want us to get pregnant.
So most of the prayers they pray against villagers is just ignorance.
God forgive us. Luke was also a doctor in the Bible, and I don't know why we are running away from medicine. Now, another sad story. A woman come, I don't have blood pressure. You confirm it, you check her blood pressure. She's doing fine. Do you know that preeclampsia only shows its ugly egg in the second trimester? So if you have done, I've done my preconception care, I cleared the list. I can now go home and be taking my folic acid and my Then one day you now have this bangy head here, and you now come to the hospital and they check your blood pressure is now 170/100. Which I have seen many people, educated people, they just thought it was a headache. It's part of pregnancy. All pregnant women have headache until they check their blood pressure. And then we now do a scary test, which most doctors get afraid of. We check whether there is protein in the urine. And once it's there, you now see us running like ambulances up and down, try to prevent the man from convulsing. Because as I told you, the tear is the least of my problem. We have stitches, sutures, we'll suture it. How will you bring a woman who has convulsed and gone into AKI, which is acute kidney failure? How will you bring her back? Most people go to the ICU and it's to the glory. And it started with what? A common headache, which was what? Uncontrolled blood pressure. The three leading causes of death now in Ondo State, our senior colleagues have done a great favor by doing the research, is these three major things have been the causes. Your blood pressure issue, anemia, which is low blood, and sadly infection, sepsis. Those are the three things that hurt our women, whether first timers or not. And as I told you, extreme of ages is a risk factor for this preeclampsia that everybody is trying to fight. Being very young, getting pregnant, and being very old, getting pregnant, especially as a first time.
So the consistency, that means there's none of the stages is the most important
at all, because different things can appear. Now, the last stage, which is what?
Postnatal.
Have you heard of what we call PPH? Now, PPH is what we call postpartum hemorrhage, that is bleeding.
Okay.
The woman has given birth to the baby, yay, give birth to the placenta. Oh boy, blood see they come out. Blood is still coming out. Oh, everybody, blood is still coming out. It becomes a drill because she can bleed out in less than 5 minutes because the body was already designed to send blood to the uterus because life is there. And she can bleed out. It becomes a drill. Everybody starts setting line to save the woman. That is also a leading cause of death. Hypertension, sepsis, bleeding out. A scary thing to think of. Part of the tear, yes, leads to the bleeding because the cervix, as I told you, blood goes towards the uterus. So when she gives birth and she tears, of course, she's losing the blood fast. So you have to look at it. Where is this blood coming from? We now have to open up. It's scary for people that, especially I enjoy seeing my house officer's face, the ones I've never seen before. When we open the woman's leg, try to put in our seams to pull out the cervix to know where the tear is, and then we now say bring suture, and then now see us sewing, and like I thought it's only tailor that used to sew clothes. If you don't sew it, that woman will go. And if you don't have the knowledge of how to identify where the bleed is coming from, that woman will go. So yes, tears is something to worry about. But if the woman comes as early as possible, we can monitor the growth of the child by doing scans to find out if that baby is going to be a big baby that will now lead to what we call CPD. That might lead her to go and have a CS, or that will lead her to a tear. We can anticipate it. We can now say, okay, this one can try vaginally, or this one needs to go to the theater. Can you see why I tell you no stage is not important? Okay. Because at that stage, a woman with a small child might not know she can go diabetic. And diabetic women are known to have very big babies. That's what we call the macrosomia. Okay. Someone that was at first normal will now start growing big. She now gives birth to the baby, and believe me, as big as that baby is, the baby is big, is strong. No, those are the babies that can die overnight. We take them straight to we admit them to NICU for observation. After 24 hours, they are good. They will discuss whether you can go home with your baby. I'm happy her eyes are opening. Most people don't know that. People always have this mentality: the bigger the baby, the stronger. No.
Yeah, which is
no.
They even shame. They size shame babies now. They size shame babies.
I was a 2.2, funny enough. And my mom kept on saying she can't put her finger close to my nose because I came out a preterma. I was 2.2, obviously. So I was classified under very low birth weight, which is a dangerous size. She kept on checking when I was breathing, and which I do like this. That, oh boy, when I became 2 months, I even rejected breast. She now gave me amala. She was scared. I said, I ate it. I said, maybe that's what I wanted to eat. They now showed my picture before and after. I was already fooling the chair. I told my mom, I can't eat the amala. Leave the breast. You can know. I should have put it till after. Funny enough, they say pretermers actually do well when they are treated well. So it's not about the size of the baby. It's about the care given to that baby.
About the care. So
that's the
postnatal
care.
Postnatal care. And many mothers actually jumps that.
Well, as soon as they give birth, she's somebody's already doing like this. See you.
Bye.
Thank God for immunization card that is accepted wherever they go. Thank God for that. Because I can imagine how many immunization they will miss because of flaunting their new baby. All those people that say I don't go born. You know that vibes.
Yeah.
And you could lose the baby along the line.
And then you go again to what? Credits will now go to villagers, which will be swearing to God, I swear I know do one. It's the truth now. Carelessness. So every stage does matter.
Every stage does matter. Every stage does matter in the actual sense. But then looking at the fact that every stage does matter and all that, because you said some things which bothers me, because every time you were talking, you are attributing it to a certain kind of ideology we have had over time, especially in the African setting, which makes us not really take cognizance of what we are supposed to do at the time we're supposed to do them. I know someone recently who still does that, has just been taking drugs, saying don't worry, everything is going to be fine and all. And they always talk about the fact that sometimes there are some that does this African, like you talk about the northern part, they do this the African ways. They say our fathers have been doing it for a long time, nothing happened and all that. Now I want to get from your own perspective the balance between the traditional parts and the normal medical parts of child delivery and maternal health. We know that we used to experience more mortality rate with the traditional, and now even with medical we still experience a bit, but at least there is improvement. But do you think that there is a part of that is still very okay for people in case, because people talk about the fact that the hospitals are very expensive. You talk about a particular region that they check their pockets all the time. That's why they don't want to go back all the time to
And
go.
let's not even forget that there are some places that it's very difficult to access medical health care.
Healthcare.
So
Not
in
even
such situations, what do they do that is actually going to be safe for them and their child?
If I say this, I'm sure some of my registrars will laugh. You just asked a very good question. Short. This is an exam standard question. Well, the question she asks now is a very important question in our residency program. It's called the delays in medicine. The accessibility is one of them. The other one is when you get there, who is there? Is he a skilled person or not? And then the other prong is, even if the person is there, does the facility have what they need to use?
Exactly.
So those are the 3 steps of delay. I told you a very important question. And the question he is asking now is, is there any benefits of conventional medicine? And I'm going to answer those 2 questions the best as I can. I told you it's an exam question. That means I have 5 minutes to talk on it.
It's a lecture, so.
For your question, is there a role of conventional medicine in modern medicine? I always laugh at people when they ask me that question, because I told you, no doctor will see you and first want to throw drugs in your mouth. We always have 3 approaches to an illness. 1, there's something we call conservative medicine. That is where you're eating, what you eat, your lifestyle. We'll try and check, if you touch this, will it change? I'll give you an example. A woman comes with me, ma, I notice I have blood pressure and I am pregnant. And I ask her, do you like salt? There is no day I cannot go without suya. In fact, if I don't put 10 Maggi inside my food, taste no will come out. And I tell her, do you know what? I'm very sorry to say, can we reduce that soya a bit? Can we reduce the Maggi? Can we take more water? Can we go for 30 minutes walk, 15 minutes somewhere, 15 minutes back home? We check her blood pressure. This thing they work like magical. All of a sudden, 140, 90 don't turn to normal thing. How you take Joma? It was what you were doing to yourself. You encouraged it and it was going to take your life. Put pregnancy aside, I'm very serious. That's the first thing any normal doctor will tell you. No doctor will throw a pill in your mouth. You check your diet, we check your lifestyle. The next thing we do is the medical part. She has gone for 2 weeks, she comes back, the blood pressure is still there. Now I have no choice than to act. I'll give you certain drugs. If we give you certain drugs and the drugs is not drugging, we change or add drugs. If we change or add drugs and the drugs is not still drugging, we might tell our boy, maybe we might need to touch something in your body, and that's where we now bring the surgical aspect. Can you see the 3 prongs?
Yeah, they are. No.
So where is traditional medicine or the conventional medicine role? I remember when I was a pediatrician in Asokoro District Hospital in Abuja, and there was this woman who had a son. His PCV levels, which is the pack cell value, which shows your level of blood, because he's a sickler or a sickle cell patient. We don't like using that sickler word any longer. She complained so much, it was so bad that each time he comes, we are always threatening that we might need to transfuse the child. And I told her, okay, do you know what? Come, let's sit down. Tell me, how do you feed this child? And I started smiling. I was like, you know, you're not giving this child any blood booster aside the minerals that we are giving through the vitamins we put in his mouth. You don't give vegetable in this child's food. Look at what you're saying. He said he wants Indomie. What is Indomie going to do for the blood? He doesn't eat, so he said you can't. And I called the son. I said, is it true your mom said you like Indomie and all this time? And I had to cancel. I was like, see, if you take Indomie, you'll be putting blood inside your body. Come, let mommy make this vegetable soup. Let her put correct shaki and liver inside. He started smiling. Like he likes that. And I told him how to make soup or drink. And I taught her the tricks of adding pineapples to make it naturally sweet. Apples. Sobo is actually a very rich source of vitamin C. No jokes, I'm not taking any glory, I'm giving it back to God who gave me the knowledge, because I did biochemistry and I did nutrition. For the first time in his life, he got a 30% PCV. And before I left, it stayed that way. Till now, she called me that I'm the only one who knows how to set a line for her child, and her child has been doing so well that he came asking for me and he cried that he wants to see his doctor. But I told her I had to go for my residency. So, why this story? There is a role for the traditional medicine. In fact, I told someone that if God permits me, while I'm furthering my study as a medical doctor, I won't mind collaborating with some of the traditional medicine people, because I was impressed that there was this belt that they held the baby with that stayed for 36 weeks. It worked. That was an alternative for the sacrilege I was telling you about. Why would I be interested in that belt? I want to see it. Unfortunately, the patient level, I can track the patient down. That was impressive. It's something to actually recommend. If I can get that belt, because in the medical world, there's something we actually have like a belt. But with that belt, we use it that when a baby is breached, meaning the baby sits on his bum, it's difficult to do that baby. We actually turn the baby back to the head, and we hold the baby with a belt. Then I see somebody holding the baby with a belt for 36 weeks. How would I be interested?
Extremely.
I tell people that our forefathers were not fools. At least it's through them we are here. At least some of them were getting something right. Now I went to Chinese and I saw the option of taking Chinese medicine or Western medicine. Their Chinese medicine, stone buildings are standing, not hidden in one bush like our people.
Which is why it still looks like that.
They are standing as a building and they are standing tall and proud. Our average drugs don't even get continents. They just tell you their mouth, it has so stick and so stick. This one you put water, this one you put shinap.
I need to sugar so.
Make sure you don't put time before you drink it. But funny enough, that is what our grandfathers drank. In fact, they mix it better than how we are mixing. Do you know why? They didn't write books to tell us how to do it when they are gone.
Which is...
Why do I know this? I'm sure you're surprised. Maybe this girl, I was told by my grandmother that my great-grandmother was a herbalist. A great one at that. So maybe the medicine is not...
it's something like
something in the gene. So they were doing something right for us to exist. It showed that they did. Some of them got it right. In short, I'm sure they were a herbalist of herbalists, which my grandma was termed. So there is something that we are doing right, but the problem is that we are failing to market it. Look at how Nigerian music is doing today. I tell anybody, sing, not put tumpa inside. That market no go sell.
You can't even sell.
It's not go sell. Why can't we do that for our drugs? Why can't we do that for our education? Why can't we do that for our culture and our way of life? I see the average African man was running around naked. We didn't have a problem. But now we are clothes, but we're having increased rape. What is happening?
That is our perception.
So I tell people it's not about the girls with short clothes in the church. It's about
your mind. Your mind. Your mind.
Then, so her question, delays. We get worried because that's why I told you I thank God for the Ondo State government who encourage the EBIO, which gives them some kind of discounts, and also encourage the matrons in my hospital. I must recommend them and I must thank them. They always tell their patients, because it's not every patient that do get to see the doctor on a clinic visit, because if they don't have a problem, the nurses counsel them. The nurses are good and they tell them what to do to continue, but if they do need to see a doctor, they flag them and they push them towards us immediately. So on that aspect alone, in metro we know this woman has a blood pressure, see the doctor. This woman sugar is present in the urine, of course it might be in the blood, see the doctor. This woman has been not eating and sleeping properly, she might have anemia, see the doctor. They know the red flags. This woman has a fever, why? See the doctor. This woman says she's seeing a drop of water coming out of her. That's what we call premature rupture of membrane. See the doctor. These patients have seen blood. It might be some kind of low-lying placenta which is bleeding. See the doctor. This woman has testing breast milk and time for born never reach. That might be a dead baby in the womb. See the doctor. They know the red flags. So they make sure they always tell them what is best. And I believe in every level there is a primary health care and there is an educated nurse. So access should not be a problem for our time. Even not for those in the far places like Iktikukwa, Ilaje, those riverine areas. There are primary health care. The question, as I told you now, is when you get there, who do you meet?
Who do you meet?
And finally, if you meet someone, they get what they're supposed to use. So these are the prongs that I pray everybody, not just the healthcare aspect, but everybody as thinking logical Nigerians should pay attention to. Maybe if they need to go to churches to ask for funds, if they need to convince the federal government, if they, whatever it takes. Believe me, I believe every family has a daughter, a sister, a wife, a female entity in the house that might one day need help because she is pregnant. And if you don't act now, you might be one of them crying, God be with you till we meet again.
Anyways, we'll continue with this discussion. Let's go for a very short break. This is where we'll go on for Go Start, a segment on Daybreak Africa that enlightens you on various business ideas you could, adopt wherever you find yourself. So we go for that, and we'll be right back to continue with the second phase of the discussion. So do not go anywhere. We'll be right back. Stay tuned.
Alright, welcome back to the show of Judge Genesis to Daybreak Africa. And yes, I hope you enjoyed Go Start. I hope you learned one or two things from Go Start. I hope you're going to use or do something with what you learned from Go Start. It's very important, because you can't be receiving advice and you're not acting upon it. It's just a waste of effort. So please ensure you do something with Go Start. But then it's time to progress on our discussion. We'll be looking at maternal health and cultivating the lifestyle that helps successful deliveries. Dr. Olajide Oluwatomi has been, putting us into, I think this is the last time.
Opening our eyes.
Opening our eyes, yeah. I think I like that statement. I've never been in this lecture in a long time, so let me go back to the lecture. Let's start with lifestyle for now. Let's start with lifestyle.
I was going to go there too.
Because I think from what you said there are three things we should fear. And one of the things we should fear is embedded in our lifestyle in the actual sense, because you said that with the right diet, with the right lifestyles, you can actually, because when you talk about the approach, so the three approaches the doctors make use of before drugs and surgery comes into play. The first one comes to conservative, and conservative is very, very important towards lifestyle. Food. And thank God you have roots in biochemistry, in diets and all those kind of things. Now, do you think many of those things, with the proper lifestyle, lots of first-time mothers or mothers generally can actually get successful deliveries without stress?
Okay. Now, that is another exam question, so I'll try and attempt it the best way I can. So, is there a role for lifestyle in anybody aside a pregnant woman? The answer is going to be yes. You are what you eat. It is clearly written in different books, in different cultures, and even in religion. Yes, the Bible told people not to eat certain animals. See, today the Muslims don't eat pig. Reasons for that. Now, I tell every woman, congratulations, you're pregnant. You're going to gain at least 12 to 14 kg. That is the target. If you do beyond that, there is something we now call morbidly obesity, which can also affect pregnant women and prone them to diabetes, which can prone to that microsomic baby I told you about, and can prone to a baby that will be so big that we die. Yes, there's something we call studying infant death, which is another scary topic for another day. So how important is lifestyle? As I tell a woman, pregnancy will prone you to three things that you're not going to be ready for. One, the demand for blood. You can go anemic because your baby also wants your blood. As I said, sorry babies, you're a parasite. You're going to take all from your mother because you choose to live. It's her business to supply. So most women are going to become anemic because the baby needs the blood. So if you're not looking at your mineral supply, your blood production will be on the low side, and you're not going to become anemic. And when you become anemic, how will you survive a bleed at birth? Most women don't think about that. So I always tell the women, I know you hate the taste of ferrous. I was anemic one time in my life because I fell sick. I had severe malaria. I lost a lot of blood cells because malaria destroys your blood cells. Another scary thing for pregnant women is that malaria does something differently in pregnant women. That's another exam topic for another day. It's destroyed the blood and it hides in a placenta, which women originally don't have until they are pregnant. So that's a heaven for malaria. That's why all pregnant women are advised to take something they call Fancita. They hate that drug, but it will save you. Please, pregnant women, wherever you are, please take your 3 drugs. In fact, in the north, they even make it an observed therapy, meaning they will see you take it before you go. Because malaria can cause you to become anemic and then it will affect the unborn child. That's something we call the congenital malaria. The child is born with the malaria because the parasite was in the blood and it's got into your baby. So that's what eating can do. Now, what can lifestyle do? Lifestyle can prevent you from having hypertension, as I told you, I explained intensively. Can help you to not have diabetes. Yes, because when you stay trim, you're not overweight, the sugar in the body is controlled. Lifestyle can also help you to exercise your body for the pregnancy. There is something we call birthing coaching, where they teach you the kind of breath you should take that will help you to give birth. We watch Mind's movie. Why are you saying okay? We watch them, we see them do it. Take a deep breath in, hold your ball, do the exercise that will straighten the abdomen, so when you push it to be easier. There is something we call doula. Some will say dollar. Everybody have their own pronunciation. That's a pregnancy coach. He sees you from the moment you're visibly pregnant to when you give birth. They're the ones that will shout, push, you can do it. Sadly, now our nurse, they do everything. And most of them get tired. And that's why they say there's one wicked nurse.
Exactly.
Because I tell people this. When we tell you don't push, you see them pull. I was laughing at one of my patients yesterday. Because she was so happy she was with the baby and she even wanted me to see the baby because she felt the baby had this funny cold. And I just removed the cap and the baby was covered in rash. I told her, please keep that Ori away. Your baby don't use Ori. Babies too have allergy. Ori is a nut. Your baby is telling you, please, I don't need it.
For now.
My immunity is low. So I tell people this. Lifestyle starts not just by what you eat. It's even of your thinking. Most people go with this idea that once you're pregnant, you're supposed to be ugly. There are certain things you should not smell. There's only 2 pregnant women that impressed me. I didn't even know they were 9 months pregnant because the clothes they wear didn't even show they were pregnant. They carried their wig, they wore their heels, they painted their nails, they looked good. So their husband will not look at Nkechi outside.
Which, it happens.
It does, a lot. And I tell people, a husband that was looking at you in your bum shot is now looking at you in a gown and you're always like this. No, exercise your body, move your body, eat right. Pregnancy is not a condemnation that you must add 52 kg. I told you, it's only a 12 to 14. Maximum 16 kg you're going to gain. Most women will say, now that I'm pregnant, I must eat for Africa. You see someone that was 20 kg now weighing 52 kg. I'd be wondering how she doubled her size, let's say, in 9 months.
But some of them will say, actually, the excuses they give when they eat, I was craving this.
Yes, there are some cravings associated with pregnancy. And one of the cravings is not even a healthy one. It's called pica. Now, pica, a woman will now want to go outside and eat clay, chalk, some string. Now, that pica, according to much further research we are doing, was a sign that the woman was going anemic and she was looking for ways to put iron into her body. So they believe that clay had some certain minerals that could help, hence the hunger for that taste. So we tell women before you now start looking for things that are not edible to become edible by force. Some even eat their hair. Yes, there's some, we call them bezoas. You later will see them in scans. Funny things that happen to women. Some will scratch, some will now tell you that if they don't smell certain things, if they don't eat pepper. Every pregnancy story has their journey. And I don't judge women. However, I'll judge you for not taking your drugs to help you not to go into anemia. Not taking your fancy which is called an intermittent preventive therapy for malaria. I will judge you for that. And I'll judge you for not doing at least 2 scans in your lifetime of pregnancy. One around 18 to 22 weeks, which will help us to know if your child has a congenital issue. And one towards the ending to help us to know if the amniotic fluid is enough, if the baby's weight is okay for you to deliver by yourself, things like that you get during the antenatal care. I will not forgive you. And even if you're overweight, I told you the nurses are good. They're also trained. They're also medical professionals. I hope you know that.
Yes.
Not just only the doctors. They are there to counsel you on how you can make your lifestyle and you're eating better. If you're overweight, they'll tell you what to do. If you're underweight, they'll tell you what to do. If you're having the back pain that's making you not to come to the clinic, there are physiotherapists willing to tell you what you can do, how you can sleep with pillows. It's not only your doctors. There are many medical practitioners out there, aside your doctor, who are ready for you at your time of need when you're pregnant.
Well, you've touched a lot of things, but I want us to really dwell on this issue of lifestyle and especially feeding. Now, the 3 stages we earlier talked about, which is the pre-conceptional stage, the prenatal, and then the postnatal stages. I believe that there are certain things that one should do to build the body, to prepare oneself for each stage. So what are these things the mother is supposed to eat to be healthy, to be able to conceive? Or at that stage when she's pregnant, what is she expected to eat in order to keep a healthy body for both herself and the child? And also after giving birth, because they also tell us that after the mother gives birth, the connection is still there, so whatever affects the mother mostly would affect the child. So what are those things the mother should do and eat that are right?
So as I said, that's a very important question. I get asked that several times because everybody are worried that, and as I said, you are what you eat. So for preconceptional eating, I always tell people, for those who have the neural tube defects in their family, we tell them to take folic acid. And for women who are of the extreme of ages, We also tell them to take folic acid because they are prone to congenital issues. And folic acid kind of like has a way of reducing them. So the question I ask women, what is the sources of folic acid, is another thing you ask yourself. So you can know you good. That is why we went to school, and primary school taught us what? Balanced diets. In fact, I tell everybody, if you balance your diet throughout your pregnancy, you're good to go. You must not eat amala in your first trimester, then tuwo in your second trimester, then you eat egusi. Balance your diet. Eat what your body tells you to eat, but make sure that whatever you're eating, your diet is balanced. I was shocked to see a pregnant woman in her second trimester, I think 29 weeks. Yeah, she was 29 weeks. And I asked her, this is the second time they are asking you to do a PCV. She was like, yes. She doesn't know why her blood is low. I said, when last did you eat fruits? She looked at me and started laughing.
I'm allowed to eat.
And I won't blame people. Go and price apple.
Yeah, very expensive.
By the time you price apple, you think of that egusi soup that you can mix with a little bit of pomon. That pomon will make sense.
Prices will just give you alternatives.
Adam, razor. And then your blood will be your blood will be bloody.
Exactly.
And that money that you're supposed to use for that pineapple, you now use it to do PCV. So always balance your diet. Yes, at the first trimester, the baby is little, you don't really need much. You're battling with vomiting. So yes, first trimester is in. I always tell people, try your best to keep crackers around you. So when you vomit, you can take dry crackers, that is it. Carry your ginger along with you. In fact, one of the conservative therapy for morning sickness is ginger. I always tell them that thank God has helped us with this green ginger drink. I don't know that you know that stuff. It comes in a big pack, plenty, like almost up to 100 inside. That can take you for the first trimester easy. You can just take that drink once a day for your first trimester. I doubt you come with the explaining of vomiting, except if you're someone carrying a swing. Because swing increase HCG, and HCG is notorious for.
No.
So then we now have to add drugs for them. There's something we call doxylamine and vitamin B6. We have to increase that for them to help them reduce the vomiting. Then we might add promethazine for them, the tablets, and if it's that bad, we might have to give them the injection and admit them and even give them IV fluid, because they might lose a lot of water in the body, and that is not good for her at all, and even the baby. So we might need to admit them. Some people's morning sickness is just take ginger drink and they are good to go. Some will vomit to the extent you get scared for them, and we might need to admit them. So first trimester issue is mostly the vomiting. The baby is tiny, the blood is not a problem. However, when we come to the second trimester, this baby is into business. Now that I have survived not falling out of your womb, most miscarriages of first trimester are congenital. It's God doing you a favor. I always tell them they should not cry, because I say the last thing you want to do is to say Bala and he's looking at his son, and you're calling Kiki and she's looking at the ground. You don't want that. Nobody wants a child drooling. So most of the congenital issues naturally miscarriage. God did you a favor. So now that this child is now into the business of staying, let's help the baby stay. Now you have to eat, because your baby is going to demand blood for his blood, calcium for his bone,
of course,
and yes, skin for his skin. So you better put those veggies into the business, because we all know that fruits and vegetables are one of the vital things for the skin. And the funny thing I tell people about the skin is that it's scary. Skin comes from, let me do a little bit of science. Skin comes from the ectoderm layer, and that ectoderm layer is what is responsible for your central nervous system. Yes. So why do you think you're doing skin things? You're also doing brain things. So do your child a favor. Please eat that vegetables and your fruits in the second trimester. Not just for the blood, but also for the brains. Then third trimester, yes, the baby has grown finished now. I have to drop the baby now. So what is the problem? You again, mama. At first you are vomiting, you are the problem. Now you're the problem again, because you're going to give birth to a baby. You're going to bleed. Let's up your blood and let's prepare you for the bleeding out, because whether you like it or not, you're going to bleed. In short, women are expected to lose less than 500 mils of blood. Have you seen a bag for giving fluid? This IV drip they buy, that is exactly 500 mils. Imagine pouring that on the floor. That is normal for delivery. Anything above that 500 is what we call postpartum hemorrhage, another leading cause of death in women. So we don't want the woman to lose so much blood, and if she does, at least let the PCV be high enough, so that what she loses will not be so bad. She might go home successfully, just putting oral drugs again, just like in the beginning, in her mouth, and she's good to go. And she's not. Might need to transfuse. So, first trimester, all about the woman. Second trimester, mostly about the baby. Third trimester, about you and the baby.
Yeah.
Let's finish what we start well, and let us expect the bleed. I hope that covers.
It covers.
It does.
It covers. It covers virtually in all aspects and all that. Then let's take this back a bit, because I remember that when I started, I talked about the circumstances that comes with the pregnancy and all that. Because when we are talking about this issue of lifestyle, I discovered that we looked at the fact that across, it's always a different story for different people. And for first-time pregnancies too, especially, we discovered that many came from different circumstances into pregnancy. And like you said, it's sometimes the first questions you ask, so you know how well to address. Now, for ladies who maybe their own story to pregnancy was kind of terrible, the kind of circumstances that we definitely know that financially they might not have what it takes, psychologically they might not have what it takes, even when we talk about socially, when we talk about the family, they might not have what it takes actually to go through that journey of 9 months. Are there tips for them to still expect success? At least it's not the baby's fault that you had those kind of circumstances and all that, but you could be sustained when the child too can be sustained. How do you address such issues? It's just out of curiosity I'm asking this.
As I tell people, it's not a proud thing to say, but we do have to anticipate the worst in our profession. In fact, some people liken us to police. The way we question them when they come is as if people think it's an integration. What is your name? Where do you come from? What is your religion? People think that we do that to just embarrass them. Now, what is your name? Will give me an idea of if you're Hausa, Yoruba, and Igbo. I'll now get an idea of your level of education.
Okay.
Are you a Christian or Muslim? You're a Christian. What denomination? Some are Jehovah Witness. They want nothing to do with blood. I get worried about that patient, because if she dare bleeds out on my table,
What happens?
now can you see that we're not just looking for trouble, we're investigating. So as I told you, from the question of asking index pregnancy, that's this pregnancy that you're carrying, we ask you, was it spontaneous? Was it planned? Was it wanted? Now for those who tell us it was not planned and it was not wanted, they fall into two categories. One, a careless lover, a girl who thought her boyfriend would be there for her. Baby, if you there for me,
I did it for you.
boy, no there for her. Oh boy, waiting be time, not time to cut out my baby, my baby. And only her go carry that baby. That situation, I even thank God, because at least there was love in the beginning. The second group are the ones I hate to talk about. Part of the reason why I want to do a career in law. The innocent girl who was walking back home carelessly in the night and got raped. There are people like that who come unfortunately pregnant. The story they don't want to talk about brought an answer people are praying for. A pregnancy. I hope you know the same hospital people come with infertility. I've been trying. Then someone walked carelessly in the night. Not even her fault. Maybe she just finished church service. I got one story like that. And she made a wrong turn. She was contemplating whether she should just go home or she should go and buy Indomie. And then the vomiting was not just malaria parasite. It was a 2-month-old pregnancy. She saw a bleeder and she thought that was her menses. There's something we call implantation bleed that most people mistake as menstruation. It was the second menses that she did not see that made her think she should see a doctor. That now led to the story she was trying to bury. Nobody wants to remember they are being raped. If most people ask me, why are you raped? Because the way you get them, I say because I have read, I have watched, I have seen, I had friends.
So must have had close acquaintances.
And I now work in the departments where they report themselves. So I relive the story again and again. Even in the department of pediatrics, yes, I was shocked where I worked for before. One of the most terrible cases I had to ever experience in my life. A 14-year-old girl walked into my clinic and then a senior colleague told me that I should just clack her and just treat her for peptic ulcer disease. And then, me being who I am, anybody who is above the age of 12, believe me, you have a boyfriend, I will ask you, so how far have you started doing it? And this girl trembled. I was like, that's not a reaction of a new love. New love is mostly it's like something is wrong somewhere. I locked the door and I asked her, who touched you? And she started crying. A very unfortunate story that I don't think I should discuss, but I will try to be as discreet as possible because I'm not calling names here. She said she had someone who was tutoring her, who was also tutoring her younger sister, who first of all was very manipulative enough, someone who even knew her father, to first dilate that place using his fingers and then finally put the real thing in. Not to only her, but to her younger sister. So if you don't investigate your patients properly, what we call clacking, which my seniors are always provoked with us. I don't talk when they are talking because an important question that you miss out might either ruin someone for life, or that silly question you ask might bring something to light. Now that girl, if I just listen to my seniors, I'm just giving her omeprazole, blah blah blah,
and then the next thing they think is ulcer.
But now, because of the question I asked, I now protest for them to do a scan to find out other things. It was not a peptic ulcer. Not like I'm taking the glory. It goes back to God. She now had pyelonephritis of both of her kidneys because what he did ascended from the reproductive tract into the urinary tract up to the kidney, and that was the pain she was feeling at the level of the stomach. So that's why everybody kept on treating her for peptic ulcer for the past 2 months until the right question was being asked. We now have to send for the younger daughter, and that was battling with genital tract infection. Because what is a 9-year-old doing with sex? So back to the question that is being asked. There's plenty of things that you can do about your lifestyle, about how you approach anything that does, whether pregnancy or not. You just have to accept as an adult that a mistake has been made. How are you going to face it? And as I told you, pregnancy is a multidisciplinary approach. Most people don't know that. I see patients like that, and I've already written to the psychiatrists and the psychologists. You have a patient. There's a rape case here. Of course, she did not plan for this pregnancy. I write to the social welfare. There's a rape case here, and she's pregnant. Of course, she did not plan for 9 months feeding of clothing and everything. She will need funds. I write to my CMD. Oh boy, there's a rape case here. Oh, are you sure you don't go call lawyer? Can we inform the police? You're right. It's not just about us. That's why we have specialty in there. You go right to the internal medicine. I don't know whether this has left the womb and has gone to other organs. Please come and make your own decisions. So as a team, the hospital will rally around such persons. I don't want to make Liverpool people happy. No pregnant woman walks alone. Your team are right beside you, with us being in front.
Well, we're actually out of time, but I have 2 questions before we finish in 30 seconds.
The time stop now, actually.
The first one is, are there specific food or fruits that pregnant women shouldn't eat? Because there's a belief that some people should not eat pineapple or some other things, or okra. Are there specific foods that pregnant women should not eat? And lastly, what is your last word to pregnant women out there, or those seeking to have children?
Good. So food that they should eat or not eat. Do you know that water we drink is dangerous? Yes. When you take so much water, there's something you call, that's not good here. But yes, taking too much water is not good. You can dilute your body to the extent you can have hyponatremia, which is sodium hypochloremia. So if too much of water is not good, too much of anything is not good. So everything should be done with moderation. Yes, the rock pawpaw has something in it that can trigger contractions. Okay. Yes, those are what the herbalists use to help women that were saying they had poor contractions to contract back then. Some tribes will tell you that if you want a smooth pregnancy, you should take a big lump of okra. And it works for some women. Plenty of women have told me that it's worked. In fact, the BTAH say they do them and it work. And those are the research I tell you that I'm not happy we're not taking action for. Chinese have bottled their medicine. We were still playing put tincture. So They are rare drugs because I tell people the Yoruba women were not just blessed with twinning due to DNA. The food they ate, yam, has estrogen. We call it phytoestrogen. So it's like Yoruba women naturally take what we call fertility enhancers.
Okay.
Yes. And that's why we are blessed with twinning. In fact, they located where the highest twins are here in the West.
Yeah, in your state.
And they now found out that there is this particular yam.
There's this particular yam.
So what you eat matters. Moderation of everything. So yes, you could avoid unripe purple because yes, they are nutrition for causing contractions. They are like your oxytocin in the body. And then if you want to get pregnant, yes, you can go and eat yam. Please come to the West and eat some yams. Maybe it might help out because it's a phyto and it's natural. It's not synthetic.
Okay.
So for those who don't like putting drugs in their mouth, there you go, come and eat yam. And then my final say to pregnant women, one of my senior colleagues said that pregnancy is not a disease, and I repeat, it is not a disease. It's a natural thing that haven't happened in the natural world. In fact, the animals don't have doulas like we do. They don't have midwives like we do, and they give birth happily in the wild. But look at how they behave. They eat what they're supposed to eat. They avoid running when they're supposed not to run. Some pregnant women, you see them putting firewood on their head, fetching water, and later they will not say they had a miscarriage, and they'll be saying, blaming their ancestors. By the time you put pressure on your head, you're increasing your abdominal pressure. It's squeezing the uterus. You might now trigger a sensation. Some of them now take castor oil or things that can stimulate spurging. Now the rectum is closer to the uterus.
Yeah.
Stimulating the rectum can stimulate the uterus. Next thing you're now seeing yourself having contractions. So there are some silly things we do, pregnant women, that we should stop doing them. Please go to the nearest healthcare center. They will know when to refer you to either a secondary or a tertiary center. As I said, pregnancy is not a disease.
Thanks so much
for joining us on the program this morning. I have learned what I have never learned before on this program.
Great.
And I cannot wait to have you here again.
A pleasure.
I wish I had known what you are saying now. But then at least the coming generations.
Alright, this is where we end the discussion for this episode of Daybreak Africa. We're not done with Daybreak Africa, so we're going off for sports right now, and then we'll be back to say our goodbyes. Just stay tuned and enjoy. Welcome back from sports. I hope you enjoyed that, you sport enthusiasts out there. Well, it has been a very interesting discussion so far. Pregnancy is not a disease.
Yeah,
That was the last statement.
I think people need to even realize that it's not a disease.
It's not a disease.
Though for men it's sometimes stressful, but
with so many things, I'm telling you, my eyes is more open now.
extremely.
I've never heard this kind of explanation before pertaining to. I mean, I've been with a pregnant woman before, twice, and then I could see so many things. But if I had more explanations like this, then maybe I would have understood certain stages and the reasons why whatever was happening was happening.
Yeah, I think Nigeria is even blessed to have doctors like that who, from what she calls the clacking, they are able to find out, diagnose what's actually.
Exactly.
And this is the first time ever. No, I said it at the beginning, and this is the first time ever I'm seeing someone talk about how did you get pregnant?
How did you get pregnant?
What
Why
led to
are you
it?
getting pregnant?
Why are you getting pregnant? Do you want
Do you
those
want to
first
take it?
questions alone should tell you how to treat a patient and how to go about it. I think we are a blessed nation. We just need to really make use of our resources around us and all that. And the fact that, but then one of the things I just realized here is that you can never try as much as possible to be ignorant as a pregnant person.
No,
you
can't afford it.
You can't afford
you have
it.
two
It's
lives
risky.
now to save.
It's risky. And one of the things I took out of the whole discussion was that I think it's high time we begin to look at our traditional means and begin to look for means of upgrade or take the positives out of them, because I think to a very large extent we can't totally bastardize them and say they are not doing well. There is something about them that let's go back and check. Let's go back and check. Let's professionalize it, because even the conversion, the Western one, we're making use of right now, it started from the traditional. And
definitely.
a particular country decided a system.
You can't do away with it.
You can't do away. So we can make ours way better. So let's just look into it and all that. But at the end of the day, the major thing here is take your health seriously. Take your health seriously, and like she said, if you balance your diet, you will
You don't
have
have an issue.
simple as
You will not have an issue.
So I think that balanced diet will be a talk for another day.
No, that would be a talk for another day. Because it's quite wide.
Extremely wide. Yeah.
This is where we'll be ending this show for today. Thank you for staying tuned and enjoying the program with us. And definitely we'll be coming your way again next time. I remain Angela Daku.
And my name still
Beautiful day.
remains Ikhonede Joshua Adeji. So have a beautiful day. Bye, guys.